Have you ever felt like you or your surroundings were just a figment of your imagination? Many people have felt this a time or two in their lives, but when this feeling ceases to dissipate, there might be a serious psychological mental illness at hand. What I'd like to talk to you guys about today is a psychological mental illness called Depersonalization Disorder. And we're just going to spend some time discussing what it is, the causes of the disorder, and some of the treatment options that are available out there. MayoClinic.com defines depersonalization disorder as a dissociative disorder. This means that for the person suffering the disorder, the concept of memory, awareness, perception, and identity of self is completely lost. And when these four things are lost, it leaves the person feeling very detached physically and mentally from themselves and their surroundings. And the physical feeling of this disorder can be compared to what a person feels when they're undergoing nitrous oxide, which is also called laughing gas. In the International Journal on the Biology of Stress, Phillips and Sierra explain that a person suffering this disorder become numb to the situations that are surrounding them. And this occurs because they can no longer grasp what it means to experience emotions. So as you can hear, this disorder directly affects the emotions that people experience. And knowing that, we can move into what causes this. In many instances, this disorder has emerged with no triggers, but with a lot of research done on this disorder, the British Journal of Psychology offers an article written by Montage, Sierra, and other colleagues that explain multiple reasons that they have found through studies why this disorder has occurred in many people. And the first is they found that the majority of people suffering this disorder have experienced large amounts of anxiety at one time in their life. And second, they found that a large number of the people suffering had also experienced post-traumatic stress syndrome in their past. Now, these findings can be directly correlated to the findings that Simon and Abigail found while writing their book called Feeling Unreal. And what the authors discuss throughout the book is they touch on the fact that when a person experiences a large amount of anxiety, it's a natural defense mechanism for our body to just shut down. And that's what the book is about. They talk about how the patients that are suffering this disorder have distanced themselves from a situation at one time that would have otherwise been too overwhelming, so they just shut down. And then they remain in that state of shutdown, which leads to this disorder. And it is through something called neuroimaging that doctors and scientists are able to study the brain for this disorder specifically. And what neuroimaging allows scientists to do is to compare the brain activity of a person that is suffering to the brain activity of someone that is not suffering this disease. And knowing that, we can move into the treatments. And the medications that have been prescribed for many of the people suffering depersonalization disorder are the same medications that are prescribed to people suffering anxiety disorders and also depression. Unfortunately, all the studies that have been conducted to find that these same medications work for depersonalization disorder haven't been proven. So there's no consistent evidence that shows that these medications actually work. Fortunately, there is very promising results to a treatment which is a psychological counseling method called behavioral therapy. And in behavioral therapy, the patients reinterpret their symptoms in a non-threatening way, and then they focus on the reactions that they have once they have come to terms with that knowledge. So basically, they're acknowledging the ways that this disorder is affecting them. And then they try to manipulate the behaviors that follow knowing that they have this disorder. Because oftentimes the people suffering don't realize they have the disorder. Another treatment option is transcranial magnetic stimulation. And before I go on, I just want to kind of go back. I had mentioned that the brain activity that scientists follow kind of allows them to look into where this disorder is occurring, chemically in the brain. And in every brain, certain parts of the brain are in charge of certain emotions that we experience. And this transcranial magnetic stimulation allows scientists to go in to the parts of the brain that are dormant, that are not active, that are stopping these patients from experiencing emotion. And it allows scientists to re-stimulate, reactivate the neurons in that part of the brain so that the people suffering this disorder can once again feel emotions where they once didn't. So knowing that, now we have an understanding of what depersonalization disorder is, some of the causes, and then the treatment options that are available out there. And now I would like to just open up for a moment and allow you guys to ask any questions that you have. Thank you.